The topic of my talk this morning is evolving respiratory viral testing and impact on patient management. In keeping with educational requirements, I have the following disclosures to make as listed on the slide. I would like to also introduce to you my place of work, which is the Ohio State University Medical Center in Columbus, Ohio. We are a large tertiary care / quaternary care medical center, and listed on this slide shows you that we have several different hospitals that are part of our hospital system, and we're about a 1,200 bed hospital overall. In the last 12 months, this slide also lists the statistics in terms of outpatient, inpatients, and ED room visits, so you can see we're a pretty busy, vibrant place. In clinical microbiology, we perform a lot of infectious disease comprehensive testing, and we had about 269,000 billable tests last year, of which approximately 1/6 were directly attributable to molecular diagnostic tests. What I'd like to do today is review with you 3 educational objectives as listed on the slide. Firstly, I'd like to review commonly used current and new testing technologies for respiratory viruses and describe their advantages and disadvantages in different clinical settings. I'd then like to discuss practical issues in implementing respiratory panel tests and relate some of our own experiences. Lastly, I'd like to discuss the benefits of respiratory viral panel testing in patient management and formulate some recommendations. So starting off with the first objective, first and foremost, viral respiratory tract diseases, as we know them today, account for a large proportion of acute morbidities. About 75 to 80% of all acute morbidities are attributable to viral illnesses. These cause major loss of time from work and school, and significant financial and social losses as well. We have a number of cases of upper respiratory tract infections that we go through every year. It is estimated that children in general have about 4 to 8 bouts of upper respiratory tract infections a year, as compared to adults that may have 2 to 3 bouts of these infections. These can also cause lower respiratory tract infections, and in fact, the lower respiratory tract diseases is the 4th most common cause of death in high-income countries. And the very old, the very young, and people that are immune compromised are certainly at risk for complications. So we know that there are many respiratory viruses that infect humans, and I've listed some of these here, especially the ones that we look for more commonly are the ones that are well established, like influenza A and B, respiratory syncytial virus, parainfluenza viruses, adenovirus. We also look for rhinoviruses, enteroviruses, and human coronaviruses. However, some of these viruses are difficult to detect in the lab. Why? Because they require special culture conditions, special temperatures, and are not always easy to detect. There have been new pathogens that have been identified since 2001, such as your human metapneumovirus, which is somewhat similar to your RSV. Then we have several coronaviruses, as listed here on the slide. And then we have the human bocavirus as well, which is a new parvovirus that has also been identified as a cause of infection. Interestingly, with human bocavirus, what we have seen is that human bocavirus likes to appear, and along with other viruses as co-infections, which can cause maybe perhaps greater severity of disease. Of unknown significance are your parvovirus types 4 and 5 and your minivirus, which is a very large DNA virus. The minivirus was first identified in Acanthamoeba polyphagia, and then later on, patients with community-acquired pneumonia were found to have antibodies to this virus. And so we're still trying to get a significance attached to this in terms of frequency of infection. What makes it actually pretty challenging is perhaps the constant evolution of new strains of viruses. As is shown here, occasionally a new virus or type is introduced from other animals or birds into humans, which leads to worldwide epidemics or pandemics. And we are aware of a number of these pandemics that have occurred over time. And the one more recently that occurred last year, April of 2009, which was the influenza A 2009 H1N1. So we know that when one has a viral infection and then one goes to the physician, it's often very difficult to tell just by symptoms alone as to what virus may be infecting the patient, because you can see the symptoms, they overlap a great deal. And so it is important from the lab standpoint that accurate diagnostic tools be available in which to identify these viruses. So respiratory viruses, the detection of respiratory viruses from clinical specimens is important, as listed in the slide. It's important for patient management and also for promoting the rational use of antivirals and antibiotics, and also for implementing infection control measures and epidemiology. So we have special populations of patients that are very vulnerable to these infections and that would really greatly benefit from detection of these viruses.